Hello everyone, my name is Kiat. I'm from BP123. Currently it's semester 4. In today's video, I'll be reviewing on this ebook, Symptoms in Pharmacy, A Guide to the Management of Common Illnesses, written by Alison Blenkinsopp, Martin Duerden, and John Blenkinsopp. This is an ebook which you can access online. Coming to the brief description of this ebook, this is a thorough guidebook for assessing and managing common symptoms and illnesses seen in the pharmacy. Pharmacies and pharmacists are often the first source of information and advice used by a patient when health problems arise. This book supports pharmacists to recognize symptoms, advise with confidence, and recommend appropriate treatment or referral, while also providing a comprehensive digest of common conditions ideal for both practical use and reference. Informed by the experiences and expertise of seasoned pharmacists and GPs, each chapter in the book provides pharmacists and their staff working in the community with a decision-making framework, along with suggestions on when to refer, contained within summary boxes. A unique feature of this book is that case studies are provided throughout in which pharmacists, doctors, nurses, and patients themselves describe assessment and treatment of a wide range of common problems. This ninth edition of this book also includes consideration of conducting pharmacy consultations remotely as well as in person in the pharmacy. New content on COVID-19 and long COVID in pharmacy practice. Information about medicines recently reclassified for OTC supply. Expanded content on women's health, including information on desogastro, menopause, and incontinence. Broadening of the insomnia chapter to include consideration of mental health problems. Increased content on non-drug therapy options and their supporting evidence, a summary of evidence sources at the end of each chapter, decision-making support for unique cases which involve ethical dilemmas. Practicing and foundation trainee pharmacists as well as undergraduate pharmacy students like us and other healthcare professionals will find symptoms in the pharmacy, a guide to the management of common illnesses invaluable when dealing with both common and obscure symptoms and illnesses. Alright, coming to the table of contents, you'll be seeing a lot of chapters being covered here, and each chapter is covering different signs and symptoms or disease, I would say. So, for example, in chapter 1, it covers respiratory problems, which is very useful for pharmacy students. As a pharmacy student in IMU, you'll be learning about respiratory system in semester 3. So, this is a very useful chapter you can use as a reference. In chapter 2, COVID-19 and long COVID is covered. Chapter 3 on gastrointestinal tract problems, which is learned by the IMU pharmacy students in semester 2 as well. So it's quite useful here. Chapter 4 on skin conditions. Chapter 5, painful conditions. Chapter 6 on women health. Chapter 7 on men's health. Chapter 8 on older people, frailty and falls prevention. Chapter 9 on eye and ear problems. Chapter 10 childhood conditions. Chapter 11 on insomnia and mental well-being. Chapter 12 on prevention of heart disease, which will be learned in semester 3. Chapter 13 on malaria prevention. Chapter 14 on pharmacogenomics, and there is also an appendix on the summary of symptoms for direct referral, basically the red flag symptoms. So how could you access this ebook? Basically, you can read online. You can click over here and you can directly read online via this website without even downloading this ebook. If you find this quite inconvenient for you, you can even download the book or download the PDF chapter. So for example, if you are interested in learning about respiratory problem, you can click download PDF here. And here you go. This is the PDF file that you will be downloading the entire chapter of the respiratory problems. And yeah, in addition to the big chapters, there are also subsections under each chapter. So when you click on show subsections, they'll be showing you the subsections that will be covered under each chapter. So for example, respiratory problems, the common illnesses or signs and symptoms are covered. First one, cough and cold, cough, sore throat, allergic rhinitis, respiratory symptoms for direct referral. Basically, it's quite a useful ebook for you, especially in terms of responding to symptoms and also patient counseling, whether medication counseling or even non-pharmacological lifestyle modification counseling is quite useful as this book covers most of them. So for example, chapter 3 GI problems, which will be learned in semester 2. So coming to the subsection, there's typical mouth ulcers, heartburn, indigestion, nausea, vomiting, motion sickness, and its prevention, constipation, diarrhea, the typical one, IBS, and hemorrhoids. So basically, you can choose to download the PDF of each subsections instead. If you are not interested in downloading the entire topic, you can choose to download each of these subsections separately as well. Just for an example, here is an example of the subsections downloaded. GI problem, I just downloaded the constipation one. So what will be covered basically, this is on constipation. It's quite useful as cover most of the thing. You need to know what you need to know about constipation, any previous history, what's the diet, medication. This is basically your somewhat similar to WWHAM on history taking, and the significance of questions answer, details of bowel habit, associated symptoms, why you need to take note on all this, blood in the stool, red flag symptom, bowel cancer. And here are some common symptoms of bowel cancer. Uh, Interactive and simple diagram here as well. And they're talking about diet as well, insufficient dietary fiber, common cause of constipation, typical, changes in diet and lifestyle, lack of exercise, reduced mobility, reduced fluid intake, the typical one. And they are talking about medication as well. So this book is quite useful for pharmacy students. And I also enjoy reading this ebook quite a lot as it covers not only the pharmacological treatment, but also non-pharmacological treatment as well, which covers like diet, lifestyle modification, and whatnot. So they're also covering drugs that may cause constipation, and they're also talking about reflux symptoms or when do you refer, because when the patients visit you or the customer visit you in the community pharmacy, you need to know what are the reflux symptoms, or when these symptoms arises, you need to request them to refer to a physician. And coming to the management is covered quite extensively as well, including dietary advice, and you see fiber content such as the foods in table form, very interactive, exercise, laxative. This in terms of the pharmacological treatment. The bulking agent typical is pagula husk. Your osmotic laxative lactulose typical, and your stimulant laxative your sena, senosites, bisacordial, and they are covering stool softener as well. They are covering constipation in children as well in pregnancy. You see, they are covering not only the typical constipation, they are also considering constipation in pediatrics and also in pregnant women, which may varies, and also in older people as well. So here are some practical points. Fluid and caffeine intake, which might cause constipation. If there's caffeine intake, improving toilet routine. And another thing I like about this ebook, which is quite beneficial, is that they provide case study as well. You can see here there's a constipation practice. Uh, let's read the Mr. Davasti is a middle-aged man who occasionally visits a pharmacy, complains of constipation, has several weeks, has been having a bowel movement every few days, normally every day. So his motions are hard and painful to pass. Basically, what is the patient experiencing signs and symptoms? Hasn't tried any medications as he thought the problem would go away of his own accord. Basically, no medication history. He has no problem with constipation in the past before. And what is the medication history? Atenolol tablets once a day for several years. And yeah, the case is quite long. I won't be reading everything. And they provide information regarding the pharmacist's view as well, which is quite extensively covered, and also the doctor's view. So this uh, quite useful in terms of learning about constipation on, or even all of the other diseases covered here, especially respiratory problems, GI problems, skin condition will be learning as well. Uh, Insomnia, basically all of this is quite useful as you'll be learning all of the signs and symptoms and diseases in detail with real life application as the case study is provided as well, which actually is useful in exam as well, because in exam you tend to face these case study questions, and it's also useful in OSCE as well, as uh, starting for semester 4 you're facing your OSCE examination, which will be comprised of responding to symptoms and also patient counseling in terms of lifestyle modification and medication counseling. So looking at these case studies will help a lot in terms of the in-depth understanding and real application as well, and you definitely solidify your foundation of the knowledge regarding each diseases. So in general, I will recommend this ebook to all of my peers, uh, of the pharmacy students in IMU University as well, because this is quite a useful books in terms of studying about responding to symptoms and also it covers management as well. So particularly useful in I think OSCE and also in examination as well. Uh, yeah, so that's all from me about the review of this ebook on the symptoms in pharmacy, a guide to the management of common illnesses. I'm the PTS librarian, a part-time student librarian at IM University. If there's any questions or inquiries regarding anything about this ebook or the access to any ebook, please feel free to contact any of us. Right? That's all from me. Thank you.